Doctors of Reddit, what is the weirdest thing you've seen while at work? Baby was born in a small village with all her bowels and stomach outside of her body. Gastrocosis. Mom wrapped the baby up in a swaddle and mum, dad and baby walked 8 hours to the nearest hospital. Caused quite a ruckus in the emergency department triage counter as they couldn't speak the local language and had to open the swaddle to show the triage nurse what they meant. But all was well, baby survived and went home well. Good God. It's amazing the baby didn't die of infection. But also walking 8 hours immediately after giving birth? That woman must have been strong as hell. Babies born with that usually do well. It wouldn't be ideal to walk 8 miles before intervention though. Small tip, if you ever do end up helping someone with a baby born with their intestines out, put the baby in a gallon Ziploc bag like it's a sleeping bag, obviously not the head, and then swaddle. It prevents moisture loss. Then get to the hospital. 450 pounds woman bleeding from the belly button, which was obviously a very deep innie. I resorted to a large speculum to visualize then cauterize the bleeding vessel. I don't know why, but I never realized that the belly button wouldn't extend out when someone gains a lot of weight. When we develop in utero, our umbilical cords contain the major blood vessels connecting us to the placenta. After birth, this is cut and becomes our belly buttons. Some of the vessels become umbilical ligaments within the abdominal cavity. Some women, when pregnant, usually in later months, see their belly button change. This is because the uterus is pushing everything out of its way. Intestine, bladder, stomach, etc. On the other hand, with obese people, the fat is adipose tissue and is accumulating between the skin and abdominal wall. So the belly button stays where it is and the fat builds up around it. Edit, this is also why during tummy tuck plastic surgery, the surgeons cut around the belly button, manipulate the skin, and sew it back. 8 inmates from the local jail injected themselves with another inmate's vomit because he'd had his methadone a few minutes before. All injected with the same needle, might I add. I guess the most interesting thing was seeing how quickly injecting vomit can make one septic. From injection to onset of sepsis was remarkably quick. Less than 4 hours. To add insult to injury, one had HIV, 2 had Hep C and the other had Hep B. We didn't bother working out the order of injection and just tested them all. Another story. Someone had a dart and lodged in their brain. 16-year-old was drunk with mates, playing darts. Threw a dart at his friend and got it in his calf muscle. Friend subsequently removed from leg and threw it back at him. Went right through his skull into his parietal lobe. I live in a regional part of Australia. Emergency department never ceases to entertain. Lots of obligatory butt stuff too. Add your friends to the list of things in Australia that will try to kill you. I keep it simple, everything in Australia will try to kill you. Mexican doctor here. Got a call from a patient who wanted me to check on his wife since she had been laying in bed all morning. When I arrived, I could smell rotten eggs and humidity in the room. Open the door and a body lays there, decomposed, probably 2 to 3 weeks, and the stench was strong because the mattress was all soggy due to the body liquids draining all over flesh. I took the poor old man outside and performed quick exploration, finding his left eye is moving uncontrollably and non-respondent to light. We call his family and I give them the news. Turns out he had been an epileptic his whole life but rarely took his treatment accordingly. Most probably he suffered a seizure that made him motor functional, but mentally challenged. One of the saddest cases I've encountered. That night I took a long shower, called my parents to tell them I love them. Had to take the dog in bed just for comfort. 3 months passed before I decided to do house visits again. Now I carry a hazmat mask in the car at any moment. Wow. So he was living with her while she had passed? Like sleeping in the same bed and whatnot? Sorry if this seems like a dumb question, it was just hard to decipher from your comment. Removed 14 pounds of infected flesh from a man's groin including the scrotal sac. He refused to believe he was diabetic but had stepped on a small carpet anchoring nail and didn't feel it. The only time he could figure it happened was when he recarpeted his house about 10 months prior. The filth from years-old carpet got lodged in his foot and coursed up his leg. We saved his testicles at least by sewing them up into his abdomen, but as you can imagine, we only slightly prolonged his ability to need them. Similar happened to me. I stepped on a nail but barely felt it. It infected my foot but it got better after some antibiotics. It was horrifying to feel internal pain in my foot though. It was like I was twisting my foot tendon too far constantly. It was similar to a black widow bite feeling. It was similar to a black widow bite feeling. Because we all know what that feels like. Not a doctor, but a paramedic. We were in a crazy busy metro system and we get called out for eye pain. 9 times out of 10, calls like these don't really require an emergency room. It'll be like an eyelash in an eye or something. I stride into the house and casually introduce myself and ask what the problem seems to be. The lady turns to me, showing her right eye bulging out about 3x further than it should and says my eye popped out of my head. This is a new one on me. No trauma, no nothing, just walking around and suddenly pop. Her eye's out of her skull. Holy crow, lady, let's get you to the ER. Turns out, she had a super dangerous clot called a cavernous sinus thrombosis. Basically, it clogged one of the drainage vessels for the brain and built up back pressure until her eye popped out. The doc said that most patients with her condition were in no state to have a conversation, so it was a marvel that she was up and walking and talking and complaining about her eye. Holding my eyeballs in while reading this comment. Yeah, that's enough of this thread, I'm out of here. Not a doc but was a medical researcher for a stretch. A homeless guy came in complaining of foot pain. He hadn't taken his boots off for 18 months. Doctor took one off, turned it upside down and a toe fell out. His toe, or just a random toe? You want a toes? Because I'll get you a toe. Have it here in 3 hours. With nail polish. These are the ways Walter warned us we didn't want to know about. This is absolutely tragic. Medic here. Went to a rural hospital for a clinical day, as opposed to my usual inner city trauma center I work in, which is a different brand of crazy, and we had to get an eyeball out of a woman's vagina. Apparently she was getting ready for a fight, and needed to keep her prosthetic eye safe. So obviously the best way to do that is to pop it out and stick it up in nature's pocket. Well, it turns out that both the object and its container had enough lube to make it very difficult for her to remove. Nature's pocket Lamau. Really never knew what the next sentence was going to be with this one. Believe me, I felt the same way when she was explaining it. Pretty sure she was on meth too, so we had to parse a lot of nonsense out of everything she was saying. Not a doctor. Was a paramedic student in an ER. Oncoming crew came to get me so I could see the patient. If that happened, you knew it was a good one. On top of that, the crew themselves kept talking about how fucked it was, which could only mean it was pretty bad. Guy working at a dye factory got his hand caught in a mechanical dye press. It was exerting over 1,000 pounds of force for over 5 minutes on his hand. By the time they got it out, it was partially amputated, and I cannot stress this enough, flat as a piece of paper. The 3 middle fingers were just cartoonish looking in how flat they were. The guy could still semi-wiggle what was there and could still definitely move his index and thumb. The surgeons were discussing WTF they were going to do when I was in there. And the general consensus I was getting was nobody knew WTF to do. I saw one of them prepping the guy's wife to see him. And they were just like, I'd how to say this other than be prepared it's not good. And be aware this may have changed his life forever. To this day I cannot get over how unreal it looked. Like I legitimately thought it was fake or I wasn't seeing it right. Surgery rotation in 3rd year med school, stat call from ER about a guy who had lost a vibrator in his rectum. Physical exam, NAD, palpable vibration noted LLQ abdomen. The vibrator was still on. Patient stated the vibrator had been fully charged prior to use and would last for hours. Ultimately, the attending surgeon wanted to avoid surgery due to the still-on vibrator leading to potential complications. The residents made the surgical intern manually pull it out to avoid surgery. Intern ended up getting it out along with a couple of hotel-sized shampoo bottles. Patient discharged home from ER in stable and improved condition. That's why butt toys have a flared base. Practice safe butt stuff. If there's one thing I've learned from all my time wasted on Reddit, it's this.